This little pill, so tiny it's almost invisible. Yet it saved over 100,000 lives each year due to its ability to prevent blood clots that could cause heart attacks and strokes. But in recent years, something has changed. More and more people have stopped taking it. Why? Is it safe? Is it no longer as effective? Or is there a hidden risk? Let's find out together. In this video, we'll take an in-depth look at the benefits and risks of aspirin and understand when it's truly helpful to take it and when it might be better to avoid it. Before we get started, don't forget to hit subscribe and turn on notifications so you never miss out on content that could literally be life-saving. Why is aspirin still so popular? Over the past few decades, aspirin has been considered something of a miracle pill. A simple and inexpensive way to prevent cardiovascular events. Its popularity grew because it's an over-the-counter medication, available to everyone and recommended in many situations, even as a preventive measure. People commonly take it to prevent blood clots. The same clots often responsible for heart attacks and strokes by blocking blood flow to the heart or brain. Many people view aspirin as a silent ally for maintaining heart health. But as we'll see, the story of aspirin is more complex and controversial than it seems. The 2022 shift, new guidelines on aspirin use. In 2022, the U.S. Preventive Services Task Force updated its guidelines on using aspirin to prevent heart attacks and strokes. Until then, aspirin was recommended for many people over 60 as a way to prevent these deadly events. But now the new guidelines advise aspirin only in select cases. Why? What led a panel of experts to question the use of a drug that, until a few years ago, was seen as a guarantee for prevention? The answer lies in the reassessment of the risks associated with aspirin. While aspirin is extremely effective in reducing the likelihood of clot formation, it also carries bleeding risks, particularly gastrointestinal bleeding and, in some cases, even brain bleeds. The task force's decision reflects a new focus on age-specific risks and individual clinical circumstances, highlighting the need to distinguish between primary and secondary prevention. A journey through time. The history of aspirin. To understand how we got here, let's take a look at the fascinating history of this little pill. Aspirin has ancient origins. As far back as 4,000 years ago, the ancient Sumerians discovered that willow bark could reduce fever and pain. But it wasn't until 1897 that a German chemist named Felix Hoffmann, working for Bayer, managed to synthesize a modified version of the active ingredient in willow bark, salicylic acid, creating what we know today as acetylsalicylic acid or aspirin. From that point on, aspirin became a cornerstone of modern medicine, initially used to treat pain and fever, and later for its preventive effect against heart attacks and strokes. What was once a revolutionary drug is now found in nearly every household, and many people consider it a simple and accessible solution for various health issues. How aspirin works to prevent blood clots. So how exactly does aspirin work? Its most well-known effect is definitely pain relief, but what's more interesting is its ability to prevent blood clot formation. When platelets in our blood activate, they form a kind of net that, if uncontrolled, can lead to a clot. Aspirin prevents this activation of platelets, effectively blocking the first step of the clotting process. For doctors, this anticoagulant effect is the main reason aspirin is still prescribed, especially for those who have already had cardiovascular events and are at high risk of developing more. However, as we'll discuss later, it's not a risk-free medication. Why do doctors still prescribe aspirin? Despite the risks, aspirin remains one of the most prescribed medications for cardiovascular prevention. This is because, for certain people, it's crucial to prevent the formation of new clots that could lead to a second heart attack or stroke. In fact, if you've already had a cardiovascular event, your risk of a second one is much higher than for someone who's never had one. Here, aspirin becomes an essential preventive tool. But that's not all. Aspirin is also prescribed for coronary artery disease, where the risk of clot formation is higher, and even after certain types of heart surgery. Reducing the likelihood of clots in these patients isn't just important, it's vital. Aspirin risks and side effects. If it's so useful, why is it now being discouraged for many people? The main risks associated with aspirin include allergic reactions, gastrointestinal ulcers, and, most significantly, bleeding. Even though aspirin is an over-the-counter pill, it's far from harmless. The risk of internal bleeding, such as gastrointestinal bleeding, can be a serious and, in some cases, even deadly side effect. It's this risk that led the task force to change the guidelines and limit its preventive use. Many of us associate over-the-counter medications with safety. But the reality is that if aspirin were developed today, under modern drug regulations, it would probably only be available by prescription due to its potential for serious side effects. Primary prevention versus secondary prevention, a crucial distinction. This change in the guidelines on aspirin use comes from the understanding of the difference between primary and secondary prevention. Primary prevention applies to people who haven't shown signs of cardiovascular disease but have risk factors. In these cases, the risks of bleeding may outweigh the benefits of aspirin. On the other hand, in secondary prevention, aspirin is used for those who have already had a heart attack or stroke. Understanding this distinction is essential. In fact, many people have misunderstood the new guidelines, thinking that aspirin is no longer recommended at all. But what the task force established is that for people without a history of cardiovascular disease, the risks of aspirin may outweigh its benefits. Using aspirin during a heart attack. Despite the new recommendations, there are still situations where aspirin is extremely helpful, such as during an ongoing heart attack. If you suspect you're having a heart attack, taking a full 325 milligrams aspirin can reduce the risk of heart damage. In these situations, time is crucial, and aspirin acts quickly to slow down clot formation. If you think you're having a heart attack, the two things to do immediately are take an aspirin and call emergency services. This simple action could mean the difference between life and death. Natural alternatives to aspirin. How effective are they? For those who can't or don't want to take aspirin, there are natural alternatives that offer heart health benefits. These include omega-3s, mainly found in fish oil, as well as ginger, turmeric, and garlic. These ingredients have anti-inflammatory properties and help reduce platelet stickiness in the blood, lowering the chance of clot formation. While they are beneficial, it's important to remember that the effects of these natural alternatives aren't as potent as those of drugs like aspirin or prescribed anticoagulants. So for people at high risk of heart attack or stroke, it's essential to discuss the best approach with a doctor rather than relying solely on these natural remedies. Conclusion and practical advice. In conclusion, aspirin is one of the most powerful tools available for preventing cardiovascular disease, but it must be used cautiously and under medical supervision. Remember, no medication can replace the importance of a healthy lifestyle. Prevention starts with simple habits, like a balanced diet, regular exercise, and managing stress. If you'd like to learn more about how to improve your heart health, be sure to subscribe to our channel and leave a comment with your questions. We're here to help you make informed choices to protect your heart.